What is the difference between acupuncture and dry needling is a question that I get asked all the time in clinic, and as a physio who does needling with people, I thought I'd do a short video explaining some of the differences between them. So I suppose the best place to start when we discuss the differences between the two of them is actually the similarities between the two of them. So both acupuncture and dry needling, you use the same needles, so fine needles that are just inserted into the tissue in whatever area we're treating. So if we talk about acupuncture, acupuncture is a form of traditional Chinese medicine. So this has been around for hundreds of years and is still used really commonly in practice today. So acupuncture in Chinese medicine can be used for a huge variety of things. It can be used for musculoskeletal conditions, which is what we use it for. It can be used for things like anxiety, depression, smoking cessation, weight loss, and the traditional Chinese medical practitioners utilize acupuncture for a lot of these different things. So that's where acupuncture varies a little bit from dry needling and what we use in physiotherapy. So we wouldn't tend to use it for things like weight loss or anxiety and depression. So when you use acupuncture, that's based on traditional Chinese theories. So the theory of energy and meridians through the body. So if you look at a traditional acupuncture chart, there is hundreds of points all over the body that we can acupuncture for all different things. They're all linked to different organs. They're linked to different points of when we talk about sort of positive energy, negative energy. And they link them all to the elements as well, so things like wood and water and metal elements. So the theory behind acupuncture is very holistic and has a non-medical approach. Dry needling is what I describe as the Western form of acupuncture. So when we use the term dry needling, it simply means putting in a needle in the body that doesn't administer any fluid or medication. So things like vaccinations and injections are all classed as wet needling. So acupuncture and dry needling are both forms of dry needles going into the tissue. So dry needling first sort of started around the 1940s, and the research sort of continued until the 1970s, 80s, which is when they started using wet needles and injecting muscles with sort of painkillers and with fluids to try and look at what we call trigger points or tender points. I won't talk too much about trigger points in this video, but it's quite a debated term, and whether trigger points are a true thing. When people hear trigger points, we often describe them as knots. So people describe them as knotted tissue in their shoulders or in their back. However, as I've said, the evidence behind this is pretty poor. There's lots of investigations looking at scans, whether it's ultrasound, whether it's MRI, and whether there is a true change in the tissue anatomy in there. And the evidence isn't great when it comes to looking at things like that. Nevertheless, anecdotally, dry needling can be very effective with patients, and you hear lots of positives around dry needling. So what are some of the differences then between the two forms of needling? So if we look at acupuncture points are based on the meridians and the flow of energy through the body. So there is no sort of science underlying the reasons for these points. So some of them go into muscles, some of them just go into connective tissues, some of them go in the joint areas. But there's no specific scientific reason as why we put needles into these points. So when we look at dry needling, this is much more of a scientific or a Western approach to needling, and this is when we insert needles into those trigger points or tender points. Now the needling looks very different when we acupuncture or when we dry needle someone. So when we acupuncture a patient, needles are often inserted into our acupuncture points along our meridians, and the needles can be left in for anything kind of up to 20 minutes. Generally the needles are inserted, they're left in for a period of time. Sometimes we stimulate the needles, whether that be with a twist or with a flick, or they can occasionally use electrical acupuncture as well, which is when they attach electrodes to the needles and send electrical stimulus between the needle points. When we look at dry needling, this is a much quicker treatment. So we aim at hitting those trigger points, or those tender points, or those knots, or whatever you want to call them. The needle's often inserted, and then we twist it, we turn it, we in and out the needle or piston it, and that's the aim of that is to cause a twitch response, so kind of like a muscle spasm in there. This is a very quick treatment, as we said, so it's kind of in and out quickly with the needles, twisting the needles quickly. It can last sort of 10 to 30 seconds until we get that twitch response, and then we often leave the needle in for about a minute after we've done it. So very different from the kind of 20 minutes or more versus the acupuncture that we do. So what does the training look like to become an acupuncturist or a dry needle therapist? So to be an acupuncturist, people undergo a traditional Chinese medicine course. So this is often studied in China, and this will not solely be acupuncture. Nevertheless, this is years and years of training, and they become specialists in acupuncture. They're expected to know all of the acupuncture points, all of the meridians, their name in Chinese, and the letters and numbers that they're related to. So when you go for acupuncture, you will often see an acupuncturist, which is where it varies from dry needling. So as a physiotherapist or physical therapist, we undergo different training, okay? So it's still many hours of training, but it's not a 3-year course. So it's an adjunct to our physiotherapy or physical modalities that we use in physiotherapy. So I did my training in acupuncture and dry needling in the UK. So my needling course was done by the Physiotherapy Society in the UK. So what those kind of courses look like in the UK, in the US, in Australia and places like that is we learn some of the key acupuncture points that are associated with musculoskeletal pains and joint related pains in what we treat in clinic here. And we also cover the dry needling aspect of it. So as we've said before, inserting those needles into the knots and tender points. So as far as training goes, we're physiotherapists who have trained in acupuncture and dry needling. So we are not acupuncturists, and you often wouldn't see a physio for acupuncture for things like weight loss and things like anxiety and depression. That's not to say that physios can't go on and do traditional Chinese medicine and complete practices in both. So my tutor for acupuncture and dry needling was both a physiotherapist and a traditional Chinese medicine practitioner. So he's covered both bases in what he does as treatments, and obviously they look very different in clinical practice as what they treat. So what can acupuncture and dry needling do for you as a patient? So as we said, the evidence behind trigger points and tender points isn't brilliant, and the evidence doesn't hugely support the knot theory in our muscles. However, as I've said before, anecdotally patients really like acupuncture and treatment with dry needling. So thank you very much for watching the video, guys. I hope that explains a little bit about the differences between acupuncture and dry needling. We haven't discussed the underlying scientific mechanisms behind why we acupuncture and dry needle in this video. But if we see you as a patient, we'll be more than happy to explain the rationale behind why we acupuncture and dry needling. So thank you very much.